Hi, I'm Geraldine Carl with the Real News Network. This healthcare story is part of a series we are doing to help Americans make better informed decisions about healthcare reform. But we can only do this work with your financial support. The economic crisis has hit us hard. Please become a member today so that we can continue bringing you stories like this.
Were you satisfied with the answers that came from the stage today?
To a degree. I mean, obviously some of it was well thought, but let's look at the dollars and cents issue, because to me that's the most important issue of all. You've got currently 253 million Americans that are currently being covered under some plan or another. Now there are 47 million that are not covered. What we're asking under this plan is to cover basically 300 million or thereabouts with no added doctors and a shortage of nurses going forward. That can end up in nothing less than mitigated care and potential rationing. There's no way around that. The dollars and the statistics don't mesh with that.
So what do you make of what he says? There's no way to pay for this public option the way they're positioned.
Well, my position is if you really want to lower costs substantially, you would have Medicare expanded. Medicare right now has maybe about a 3% administrative cost. Private insurance, as Mr. Moran said, runs about 30%. What you have in private insurance you don't have in Medicare is profit. You have contributions to members of Congress. You have lobbyists. You have CEOs who get paid large salaries.
So to some extent, you agree with some of his critique that the public option that's being proposed by the White House doesn't lower costs. You think it should be a single-payer system?
I didn't say that, because it depends upon what the public option is. Obviously, if the public option is that you could select Medicare, then it's just what I said. Okay. If the public option is something that's watered down to meaninglessness, then it's watered down to meaninglessness. So I'm waiting to see what it's going to look like, before I would comment on whether or not it's going to reduce costs.
Okay, then let me come back over here. The single-payer option, arguably, because if you look at some of the single-payer countries, they pay far less on health care than the United States does. So if your fundamental issue is cost, take Canada, which spends far less of its GDP, far less per capita on health care, outcomes as good or better. Why wouldn't you be pro-single-payer?
Well, because Canada and England have had examples on both sides of where the plans haven't worked. People haven't been covered. There have been long waiting lines for people to get care.
Can I ask you a question? Because we go back and forth. Like, I'm based in Toronto and Washington. I go back and forth. I actually have dual citizenships. My mother's from Chicago. My father's from Montreal. Most of what's being said here about Canada is pure mythology. Like I can give you some personal stories. I got an ACL, an MRI for an ACL injury less than 3 weeks. My 84-year-old mother went in with angina and got a bypass, triple bypass the next day. There are some waiting times, there's no doubt.
Well, there have been a number of doctors who've been interviewed from Canada who've said kind of the contrary to what you're saying. And I'm not saying what you're saying isn't true, but you're going to have differing opinions.
I interviewed somebody just a few minutes ago who doesn't like healthcare reform. And I said to him, is this really about healthcare reform, or is this about your distrust of big government?
Well, the two go hand in hand. I mean, come on. You can't have true healthcare reform that's real if the government is failing every single time.
Why do you trust big corporations more than government?
I don't always trust big corporations. There are big corporation success stories, and then there are big corporations stories that aren't success stories.
And do you think the insurance industry is a success story?
No, I don't. And I think that we need true insurance reform, and that's what I'm calling for. I think that there needs to be government oversight, but I don't think that a nanny state where our government is going to come in and do a master control power grab, as they've done with the stimulus, as they did with cap and trade, and now with healthcare.
In this field, healthcare, there is no question that the government, compared to what the private insurance company's done, I'm just comparing the government's role, existing role, and the insurance company's existing role, has done a better job. Now I'm talking about the sectors that the government controls in this country, which is about half presently. It's not as if it's a completely private industry, and then the government is trying to take it over. The government already has Medicare. Ask anybody who is on Medicare whether they would want to do without Medicare. It's a very popular program.
Are you in favor of getting rid of Medicare?
$34 trillion in debt.
Yeah, but do you want to eliminate it?
I think it needs to be overhauled. I think for
No, but do you want to privatize it?
yeah, I think so. If you can take out not only the waste but any type of corruption.
Let me ask you both a question, because I think you guys have something in common. You get into a position of having to defend aspects of government you actually don't like defending, is my guess, because you know about corruption in government and you know about the power of big lobbies and the extent to which both many senators and congressmen are giving contributions that influence their vote. And I'm sure you hate all of that, but you kind of wind up having to defend government here. You don't want to be the agent for big insurance companies, but you wind up being that here. If you felt you had more democracy, more oversight, more accountability in government, would you guys be on the same path? Would you agree with single payer?
I don't know about single payer, but I think that I still don't believe single payer. You know, you're talking about a master government control. Is that what you're saying?
Government insurance plan like they have in Canada.
Yeah, they'd have to have massive oversight. I see in this potential of Obamacare, I see the makings of a lot of people gaming the system.
I do object, and I believe we agree that we should eliminate the power of these insurance companies with all their contributions. That poisons the debate. But what I resent the most when I'm paying for my private insurance right now is that my money that I pay for insurance is not for health care. A good chunk of it is to pay for
administrative costs.
Not just administrative costs, but the contributions the insurance companies make to members of Congress. Under Medicare, when I get Medicare in 2.5 years, I am not going to be paying for contributions because Medicare, of course, doesn't make contributions to members of Congress. I think all that sort of stuff should be eliminated. And the reason that if it's a robust public option, in other words, if it really works and gets a lot of people in that, and that reduces the share of the private insurance market, I'm all for that, because what we're doing right now is we're enhancing their power. And that is not good, because what in essence it is a scheme to take our money, whether through taxpayer subsidies or through the purchase of private insurance, and use that money to leverage their power so they can buy more members of Congress, so they can have more lobbyists. Right. They're spending $23 million. Let's say there's a fixed amount of money. Let's call it $1 trillion over the next 10 years for health care. The more of that money goes toward the subsidization of the purchase of private insurance, the less money that's going to be available for health care.
Hi again, I'm Geraldine Carl with the Real News Network. Over the next few months, we plan to investigate, report and debate the different proposals for American healthcare reform. We will continue our series, Americans Talk to Canadians About Healthcare, and we will broaden that to include the experience with healthcare models in Europe and in other countries. We will be holding town hall debates where people can discuss what kind of reforms will create the best system for Americans. We will do all of this without corporate or government funding. This kind of independent programming is only possible if you become a member of the Real News Network with a tax-deductible donation today. The economic crisis has made things difficult for us, as it has for many others. We need your support if we are going to produce the uncompromising journalism that people need. Please click on the donate button and become a member now. If you are a member, please contribute again. Let us know you want us to continue this work.